My name's Kimberly Biss, and I am an obstetrician gynecologist that practices here in the state of Florida.
And we're going to talk about pregnancy and the COVID shots.
Correct.
And how do you know about that?
How do I know about the pregnancy and COVID
how do you know,
shot?
before you start talking about this, what qualifications or research have you done, just so we can tell our viewers?
Okay, so I have no research publications to my name. It's just that I have been practicing for 25 plus years, and if you include my residency training, I've probably taken care of about 8,000 pregnant women. So there are things that I'm seeing now that I've not seen in the past, and it all started when we started the COVID injections.
Okay, talk us through what you're seeing and educate us, please.
Sure. So in November of 2021, I had a non-clinical staff member come up to me and say, Dr. Biss, you realize we've had 8 miscarriages this month, and in a practice of mine that delivers 20 to 25 patients a month, having 8 miscarriages is a huge number. So I started to loosely track the data, but a year ago this month, I went back to January of 2020 up till November of 2022, and I had tracked not only the miscarriages we had in our practice, but also the newly entering pregnant moms. And what I had seen was our miscarriage rates had doubled from year to year, and our newly registering obstetric patients had been going down from year to year. Those are people that call they're newly pregnant in the first trimester. And that's either a reflection of them losing their pregnancies early or infertility, which has increased since these injections. So the miscarriage rate from month to month in January, or in the year 2020, for my practice was 4%. You will hear and read in obstetric textbooks that the normal miscarriage rate is 13 to 15%, which I've never seen clinically. Recent literature about 4 years ago actually showed that the normal miscarriage rate the first trimester is about 5 to 6%. I've not really seen that either. That's a little higher than what I've seen. But my average month-to-month miscarriage rate in 2020 was 4%. In 2021, it doubled to 7 to 8%, and it peaked in November of that year when my staff member brought it to my attention. And in 2022, it went up again to 15% on average month to month. In December of 2022, it was about 27%, and in January and February of this year, it was 30%. Did not normalize back down to 4% until June of this year. And what's concerning is the majority of my patients who had received the injections, that was done in 2021 and early 2022. Very few had gotten more than 3 shots. So we're still seeing some lingering effects, even though it was so, long ago at this point.
Now, are these miscarriages at the time that you would normally see a miscarriage, or are they later? Because we're hearing of later.
Yeah, so the later miscarriage, like early in the second trimester, would be more related to blood clotting issues. Usually people that have lupus, that's kind of what happens with them. I have not seen a lot of those, I will be honest. Most are in the first trimester, like about 6 to 8 to 10 weeks.
And these people have got the COVID shots at some point, either during their pregnancy or before their pregnancy. When are you seeing that?
So most of them, it's hard to track that exactly, but obviously the ones I was seeing in 2022 and in this year, they hadn't even received any injections. They would have been received back in 2021. So something is still going on that's allowing them to possibly have a miscarriage. I will tell you that 60 to 65% of my obstetric population got the injections. It's primarily Pfizer. It's about 70% to 30% Moderna. I don't have it exactly to where everybody that I've tracked, I've known that they were vaccinated, what brand it was, because sadly in my practice, I'm the only one that asks all of my gynecology patients if they've had any injections, what type, when, have you had COVID, because whether we like it or not, that's part of your medical history now. And if we don't have that data in their chart already and they show up with a pregnancy loss, it's hard to ask them that information then, because you don't want to come off as accusatory and make them feel like they caused the loss of their baby.
Or leading them.
Correct.
I have a question for you. You may not be able to answer this. So one of the other things we're seeing a lot of, or hearing a lot of, particularly in the military, is the mothers did not get any of the shots, but the fathers did. And we are seeing an unusual amount of miscarriages in that group as well. Have you seen anything? You know anything about that? I presume would mean shedding. I don't know.
Yeah, so we definitely feel that shedding is a concept, because a lot of women that had the menstrual disorders, they didn't all get vaccinated themselves, but they had been around other people that had been vaccinated. Pfizer, if you were enrolled in the early Pfizer trials and you were a male, you were told to wear 2 condoms, because obviously they knew something may be transmitted to the female in bodily fluids. So I don't have that ability to track all that. I don't ask my patients if their partners or husbands have been vaccinated. So.
Okay, so on another subject that you may know about, we're also getting reports, and that this actually first alerted me to it was another OB-GYN that came and talked to us, 2 others actually, that we're seeing babies born from vaccinated parents, as in the COVID shot parents, that have abnormalities. Are you seeing that or not?
So I have not seen any increase in my patient population with birth defects or having any issues. I did have one very strange delivery. The mom was triple vaccinated with Pfizer, had an uneventful pregnancy, uneventful delivery. 45 minutes later, the baby crumped respiratory wise, had to go to the NICU. They couldn't ventilate the baby. The baby actually had to go on ECMO, which for people listening is like bypass. The blood of the baby was being oxygenated by a machine, and then it went back into the baby. The baby survived, but there has yet to be any explanation for why any of that happened. And the baby doesn't have any genetic problem. There's no metabolic issue. It was very bizarre. That's the only weird thing as far as a baby goes that I've had. Now, I will tell you, we are seeing, and this is a reflection of not very healthy placentas. We're seeing a lot more preeclampsia, which is high blood pressure in pregnancy. We're seeing a lot more low amniotic fluid volumes around the baby. So both of those conditions are making us induce or deliver moms prior to when they're due. So some of them are preterm. My concern is we're seeing a lot of postpartum hemorrhaging. Women that bleed within the first 24 hours after delivery. And the normal maneuvers we use or the medicines we use to stop the bleeding are not always working. I had to do a hysterectomy on a woman in August because we couldn't stop her bleeding. And I will tell you, just for perspective, there are OB-GYNs that practice their whole career having never done a hysterectomy on a woman they just delivered their baby. It's not a commonly done procedure. So there's something going on in the uterus where it's not allowing it to contract normally, and these women are bleeding more.
So sad.
It's very scary. It almost makes me scared to go and do a delivery because I'm always afraid my patient's going to bleed now. It's become that common. And my anesthesia colleagues have brought that to my attention. It's not just the obstetricians noticing this now, because usually these people require surgery and the anesthesia personnel are involved.
It's interesting you say that. I spoke to a midwife, would not come on the bus, but I did speak to her, and she said that she is afraid to do home births with the COVID, people who've taken the COVID shots. She won't take them.
Yeah.
Because of the issues that she's saying.
Yeah.
So that sort of tallies up with that. All right, can we talk a little bit about infertility, because we
Yes.
have a problem. There is, and to the point where we get mothers who are struggling, are also struggling to adopt. The adoption agencies that we're getting reports that they're just 3-year waiting lists, don't even bother, and not enough people coming in to even give babies up for adoption. So something's going on everywhere.
Yeah. Well, globally, the birth rate is down. Some countries are higher than others as far as how the slope is trending. But I will tell you, we had many patients in 2021 and 2022 who had no problems prior. We had delivered previous babies of theirs. They had no issues getting pregnant. And now all of a sudden they're either having recurrent miscarriages or they just can't get pregnant at all, and we've had to send them to infertility, and they end up getting in vitro fertilization or IVF. We know that in these injections, the lipid nanoparticles, which is the fatty envelope around the messenger RNA, does not stay in your arm. The LPNs go all throughout the body. Through FOIA requests, Japanese researchers got the Pfizer rat trial that showed that. And these lipids concentrate in endocrine glands, which the testes and the ovaries are, and was most concentrated in the ovaries. My concern is that this might be a multi-generational problem, because when babies are developing in the womb and they're female, once they hit 20 weeks of gestation, they have all the eggs they will ever have their whole life. Men regenerate their sperm. Women do not regenerate their eggs. As a matter of fact, when a woman runs out of eggs, that's what menopause is. So if these lipid nanoparticles cross the placenta, which I'm sure they do, and they go into a female fetus's body and somehow concentrate in her ovaries, we're not going to know there's a problem until either she doesn't go through puberty, or she goes through puberty but she can't get pregnant later on in life.
So trouble ahead.
Trouble ahead. Maybe.
All right, so I can't let you go without asking you two questions. Number one, at Children's Health Defence, we're extremely concerned by the amount of vaccinations that pregnant women are being offered now.
Yeah.
So RSV, COVID,
Yes.
flu, Tdap, maybe a bit of Rogam, because that seems to be in these days. I don't know,
Yeah.
I don't mean to speak out of turn there, but
Sure.
a flu, I don't know. It goes on.
Yeah.
For us, that sounds like a cocktail for death.
Yes, so nobody should get this RSV injection in pregnancy because babies died in the trials. GlaxoSmithKline and Pfizer both got the same. It's not messenger RNA based platform. It's a more of a traditional where it's an antigen. Both companies got the same antigen. GlaxoSmithKline studied it on 5,000 women. They saw more fetal deaths in the vaccinated arm as compared to the placebo, primarily due to it causing premature labor and delivery. So they halted the study and they decided to not put the product out. Pfizer took 100 women, had the same statistics, but then turned around and said, well, we can't really say anything about the deaths because the study was small. They presented all this to the FDA. They got a stamp of approval. And American College of OB-GYN, CDC, chief medical officers of women's groups are now telling their people to give these injections to pregnant women. With the theory with any vaccine in a pregnant woman is that you'll give them the vaccine, they'll make antibodies which cross the baby into the baby, and then when the baby's born, the baby will have antibodies to whatever you're vaccinating the mom for. Because we're always chasing antibodies, but we should all know by now there's much more to an immune system than just antibodies. But who knows if maybe all these flu vaccines we've been given in the past, the Tdaps, we don't know what causes preterm labor. Maybe it's those injections.
And I need to ask you about the HPV Gardasil shot
Yes.
as well, because, this is our,
Yes, I've
mean,
seen his story.
the 10-year-old girl there, we haven't put that story out yet because they're in court. She only died last year from one
Aw.
Gardasil. So my point is why is it still on the market? We don't have the science behind it. We don't, all the claims that people say you won't get cancer, we don't have.
No,
That's not true. So
You're
why,
right.
and people are dying.
people are dying, and
Ovaries are being shut down. Young girls are going through menopause. This is the most injurious vaccine that we have on the market in my mind.
maybe related to endometriosis too. And I will tell you, the silver lining for me with COVID was that it opened my eyes, and I've done a lot of self-reflection. And I just hope that I didn't harm anybody. But yes, in the OB-GYN world, Gardasil is our vaccine. And knowing what I know now, it's just a shame how we were all just misled. I mean, Merck never proved in their trials that they prevented cancer. And I see plenty of women who have abnormal pap smears that have had the series of the injections. The concern now is they're expanding this to everybody because HPV is associated with a lot of oral cancers. So now they're going to want everybody to get it. And they may even start giving it to babies. I mean, it's crazy. Cervical cancer is now on the rise. And I think it's because we stopped doing annual pap smears. Kaiser was the one that did the big trial that, you know, in 2011 told us all we don't need to do a pap smear on everybody. I'm back to doing annual paps on all my patients. I'm not going to follow those guidelines anymore, and I haven't recommended Gardasil to anybody, I want to say, in maybe, I don't know, 6 years.
Thank you. And also, I think it's important to say that we were all lied to. Doctors, nurses, mothers, fathers, grandparents. It's all of us. We've all been lied to. There's no shame in us saying this is what happened to us. You know, medical training, sponsored by Big Pharma. You know, it's happened to us all, and we need to all stand together, no matter where we are, and say we've all been lied to.
Right.
And I just think you're an amazing doctor. So you're sitting here and you're warning us all about what you know, and I don't know. I just thank you so much.
Well, thank you for allowing me to speak.
Is there anything else you want to tell anyone?
Merry Christmas.
Merry Christmas, everybody. I forgot it was nearly Christmas. That cheers me up. Thank you, thank you, thank you. Thank you for everything.
Oh,